Good evening, I'm Ian Hannamansing. Tonight, Canada reaches a grim coronavirus milestone.
You must have been so scared.
A dozen deaths, more than 1,000 infections, as Canada turns to a wartime strategy to produce medical supplies.
There's potential for Côte-Saint-Luc to be an epicenter for the virus.
A Quebec mayor thinks quarantine may be the answer for his city, bracing for a surge in cases. Big banks promised mortgage relief, but responded with delays and denials.
We're not going to be able to pay.
And what about renters? 70 million Americans ordered to stay home.
I am not kidding about this.
And China declares victory over the virus, but a second wave could be coming. This is The National. After an already difficult week, COVID-19 is hitting this country even harder tonight. Canada has now moved past 1,000 cases, 214 new infections reported today alone. That is the highest one-day tally since the pandemic was declared. And with emergency declarations from coast to coast to coast, a massive mobilization effort is now forming to try to fight the spread. Ottawa joining forces with industry to mass-produce medical equipment on a wartime scale. Some Quebec hotels will donate unused rooms to relieve pressure on hospitals. Edmonton's Expo Centre will double as an illness overflow and homeless shelter. And Canada's military is now planning for a crisis that could last at least a year. Now, despite the big jump in cases today, the concern is the real surge hasn't hit yet. And so the government is kicking its response into high gear. David Cochran leads our coverage tonight.
It is in these challenging times that we also see what we're made of.
Not only what Canadians are made of, but what Canadians can make.
We are launching Canada's plan to mobilize industry to fight COVID-19.
It's a big fight, so these ministers are setting up a system to buy and build what Canada needs.
The situation is fluid and evolving rapidly. Our goal is to be over-prepared.
There are still medical supplies on the market, and Canada is buying bulk.
We have been able to secure 11.3 million N95 masks, which is over and above the order that we received for 7.3 million, with deliveries beginning immediately.
They've also bought 550 ventilators and are looking for more. But buying isn't a long-term solution.
Every other country in the world that is preparing like ours is trying to get those items too.
As more of the world shuts down, global supply chains collapse. Some countries are banning the export of medical supplies.
And this country's industrial policy will be refocused, for the time being, to prioritize the fight against COVID-19.
The plan is to create a domestic supply chain. The first link, agreements with 3 companies to ramp up production of protective equipment, ventilators, and portable testing kits. Nearly 6,000 companies have offered help, including ones that make auto parts.
So our government will help these companies shift production from auto parts to medical supplies.
It's a multi-billion-dollar plan to build a COVID-19 industrial complex. The big question that can't be answered right now is whether all of this will be enough. Other countries have seen their systems and their supplies completely overrun. And while Canada has had more time to prepare, the virus here still hasn't reached its peak. David Cochran, CBC News, Ottawa.
The Prime Minister also had an update for Canadians still trying to return home.
We're in discussion with Canadian Airlines to help Canadians stranded abroad come home. We will have more details to share, but the first flight will be picking up Canadians from Morocco this weekend.
He also announced the closure of the Canada-U.S. border to all non-essential travel effective midnight tonight, though commercial travel will continue. Trudeau also announcing a bilateral deal to turn back all migrants attempting to enter Canada away from official border crossings. There were no new deaths in Canada linked to COVID-19, although a Canadian in quarantine after catching the virus on the Diamond Princess did die in Japan. And some provinces saw substantial increases in the number of confirmed cases. In BC, 77 new infections reported today, Ontario 60, Alberta 49, Quebec reporting 18 new cases, and one city in that province especially uneasy tonight. Allison Northcott shows us why.
I bring having my meals brought up.
Lillian Horowitz is self-isolating after a fellow resident at this assisted living center tested positive for COVID-19.
I'm not to answer the door to anybody, and what can I do?
The mayor of Côte-Saint-Luc, a city on the island of Montreal, says there are at least 4 cases there, and he's worried.
The virus can spread very quickly. And because we have all these religious institutions where gatherings were going on until a few days ago, and we have so many snowbirds returning to our community, we know there's potential for Côte-Saint-Luc to be an epicenter for the virus.
The mayor is urging the province to close all non-essential businesses and to consider a quarantine in his city if cases go up. Côte-Saint-Luc is densely populated with a large Jewish community and a high concentration of seniors. One of the people infected attended a wedding with 400 guests held last week at this synagogue. All guests now instructed to self-isolate for 14 days.
The world has changed so drastically in the 8 days since that wedding took place. And at the time of the wedding, even into the next day, none of the synagogues in Montreal had yet closed. And the following morning, we made the decision to close.
This synagogue wrote to members to warn there are cases here, too, and told people who recently attended to stay home.
The general message went out to all because everybody is connected to somebody that is a senior or is compromised, whether they know it or not, they have a connection.
Montreal Public Health says all religious groups should stop all gatherings.
Religious groups are vectors of transmission, are important vectors of transmission. Please follow the order.
The mayor of Côte-Saint-Luc says synagogues there have now done that, but says it's a shame it didn't happen sooner. Allison Northcott, CBC News, Montreal.
And while many Canadians cope with losing daily customs and routines, others are coping with grief of losing loved ones. Ellen Morrow has some of their stories.
Sean Cunnington was just 51 years old, a musician, a family man, and another life lost to COVID-19.
You must have been so scared.
Tommy Dorian was Cunnington's bandmate. Cunnington had an underlying condition, chronic leukemia. No one knows yet how he contracted the virus.
If it's not a lesson as to how easily it can affect anybody, I don't know what is.
COVID-19's toll on Canada is growing. 82-year-old Mariette Tremblay died at a long-term care facility in Quebec. On Facebook, her granddaughter wrote, "We are imploring Quebecers and the whole world to show good citizenship, social responsibility, and stay at home."
I went public.
Stephanie Carvin echoes that plea.
But I wish I could be there for my grandmother and reassure her that, we love her.
Her grandmother in an Ontario care facility is sick and awaiting COVID-19 test results. And to protect residents, visitors are no longer allowed at the home.
It's just so stressful not to be with your loved ones while they're sick, and she's not alone. But it's hard because, in so many ways she has to be right now because of this situation.
A situation just beginning. Canada's major cities locked down, anxiety on the rise.
We're social animals, but we're also animals of routine. So when those routines are broken, it's really disconcerting because we find comfort in the familiar.
Comfort for Cunnington's loved ones is being found in memory. Dwayne Lau, another bandmate, was a longtime friend.
He was one of the most genuine, honest people that I've ever known, and somebody that has always been willing to help.
Now they want others to help slow the spread of COVID-19. Ellen Morrow, CBC News, Toronto.
The pandemic is also taking a toll on Canada's workforce. Today, Cirque du Soleil said it's laid off 95% of its workforce, including more than 1,300 head office staff. We have already told you about 40,000 auto workers hit by shutdowns, the layoffs of more than 5,000 Air Canada cabin crew, and 1,100 Irving shipyard workers. But the coronavirus is boosting some retail, including Walmart Canada, which said today it wants to immediately hire 10,000 workers for its stores and distribution centers, saying there's a lot of work and we need you. But for those who still go to work, there's mounting concern for their health and their potential to spread the virus. Chris Glover looks at the tension that's creating.
Up close at a construction site during a pandemic.
There is no such thing as social distancing on a job site.
Morgan Signini owns a metal fabricating company, already uneasy about keeping his workers on the job when a developer sent him this letter saying Ontario is not shut down and obligations still must be met.
That was really disturbing. I went to bed with a heavy heart, just thinking how I could put my employees in that position.
The developer told CBC News the letter was meant to provide much needed clarity on everyone's continued responsibilities.
I need to work.
For some, the paycheck is worth the risk.
I think it's okay because I work outside.
But for how long?
I won't hesitate to shut anything and everything down once I get the advice.
Screening and sanitizing is crucial at Service Canada locations. 500,000 Canadians applied for assistance this week. Under 27,000 is normal. John Minoru bailed on his application this morning, fearful of catching the infection in a crowd of strangers. But he's back this afternoon with gloves.
I was worried because I tried online, but it's all clogged.
A new release drew thousands to EB Games across Canada.
I'm actually living with my grandparents right now, so I have to be a little bit extra careful.
After a CBC story this week, precautions were taken inside their stores.
We were limiting to how many people were coming in at a time.
Officials condemned the retailer.
You're putting everyone else into danger.
Late today, CBC learned all EB Games stores will close indefinitely, but Signini fears officials are putting people in danger by allowing so many to keep working, potentially spreading the virus.
It's going to be actually crippling, even more crippling later.
Shut down work now, he says, before it's no longer a choice. Chris Glover, CBC News, Toronto.
Manitoba Premier Brian Pallister took direct aim at businesses that refuse to abide by social distancing guidelines, asking Manitobans to take each other's safety and well-being into their own hands.
I encourage Manitobans, as you come across a situation where people are not observing the social distancing rules, I'd like you to go on the internet and tell everybody not to shop there. Don't go there. Don't honor that kind of behavior. In fact, it's a dishonor. I'd encourage each of you in the media and all of your viewers and listeners to think of others right now, to contact them. Make sure that they have a sense of being connected to you. Make sure that they're able to be confident that they're part of a world that isn't just their room. Do this. This will be appreciated. Thank you. We'll beat this thing.
Oh, the emotion there from the Premier, a sign of how seriously governments are taking this. Let's bring in Dr. Alison McGeer, an infectious disease specialist with Mount Sinai Hospital in Toronto and a veteran of the SARS outbreak that began in 2002. And Dr. McGeer, things have been changing so rapidly across Canada. From your perspective, what else would you like to see from governments and from people?
Well, I think from government, there's just a limit to how much people can do. Obviously, we'd like to see more testing. There's a whole bunch of things we'd like to see come faster. But the truth is, I think in general, in government, people are working just as fast and as hard as they can. And I'm not sure that we can do much more. I do think from the population point of view, from all of us thinking about social distancing, that there is still room to move, that it takes a while to wrap your head around social distancing. It's really hard to think, I should try not to go to the grocery store today because it feels so innocuous just making small trips. And I think the hard part about social distancing is that any one thing you do is really low risk. But when you sum all of the things you do over all of the people in Canada, then suddenly we're in trouble. And so I'd really like to see people doubling down on not going out and maintaining social distance. I think that will help the most.
Well, to use your words, there is literally room to move on that. Stand by. We're going to come back to you later on in the newscast. Thanks. So COVID-19 having a major impact as each province and city looks to manage the virus. Anita Bath is tracking stories from communities across Canada for us.
And let's begin in Ontario, where there are 60 new cases of COVID-19, bringing the total to 318. test 2,000 people per day for the virus. By next week, that will jump to 5,000. Now, there is a wait of up to a week for anyone who wants to get tested, but an Ottawa company is working with the government to develop a test it says would be able to diagnose COVID-19 in just 30 minutes. It's modeled after a similar test already validated by the U.S. Centre for Disease Control. The hope is it would be available weeks from now.
It's the size of a large coffee cup, so it's totally portable. And so this now lets all sorts of users run these COVID-19 tests wherever they need it.
To Quebec now, where we are just getting word of an arrest being made in Montreal, the first in Canada. A woman who tested positive for the virus has been taken into custody for defying a quarantine order. The Premier is again urging everyone there to stay home and avoid travel, even within the province. He says he, too, is doing that.
One of my boys' birthday is Sunday, and unfortunately, I won't be able to see him. He's in Montreal, I'm in Quebec City, but that's life.
Across the country, Sobeys is installing plexiglass shields to protect cashiers at its stores. The company says we've looked across the world at best practices, and these shields stand out as a strong safety precaution. They will not be in every store immediately, but we will install them as quickly as we can. And we've also gotten word now Starbucks is joining other shops in scaling back, now only offering delivery and drive-through service at most locations across the country. Ian?
Thanks, Anita. To the United States now, where tonight more than 70 million people, nearly 1 in 5 Americans, are being ordered to stay home after several states took extraordinary steps to try to slow down the coronavirus. California, New York, Illinois, and Connecticut are ordering residents to shelter in place. They account for more than 10,000 of the over 19,000 cases nationally. But for now, Donald Trump isn't ordering all Americans to stay home. Katie Simpson explains.
The urgent message to stay home appears to finally be getting through. In California, the notoriously busy highways are nearly empty. The hustle and bustle of New York is at a standstill. Governors in 4 states have now asked residents not to go out unless absolutely necessary.
This is not life as usual. And accept it and realize it and deal with it.
The president is supportive of the moves by the individual states, but a nationwide lockdown is not in the works. At his daily briefing, Donald Trump focused on what he sees as the positive, highlighting a malaria drug he says could be used to treat coronavirus patients.
I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it.
The top doctor on the task force is not as optimistic because there is no science to show it's effective.
It's the hope that it will work versus proving that it will work.
Trump has become increasingly agitated at his daily briefings when reporter questions force him to acknowledge this situation is rapidly getting worse.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say.
Fear is very real for Americans who are now out of work.
I'm just trying to be as normal as possible. I already had a lot going on.
This is Danielle. How can I help you? This Indiana mom is among half the staff at a cafe laid off in order to keep the place running.
It was probably the hardest thing I've ever done as a manager. Because there's just nothing I can do.
More Americans are expected to be in that same position. Experts predict 2 million people will likely apply for unemployment benefits next week. Katie Simpson, CBC News, Washington.
The big banks say help is coming for people with mortgages, but what about renters?
If there's no money coming down the pipeline, we can't be sure that we can pay our rent.
Up next, the push to delay rent day. And what happens to family doctor offices during a pandemic?
I don't have what I need to do the job safely.
Plus 3 cheers for nurses.
Thank you, healthcare workers!
The unique and socially distant way that people across Canada are showing support. We're back in 2. The spread of COVID-19 has changed the financial positions of many Canadians, with the source of their next paycheck now suddenly unclear and the next mortgage or rent payment still looming. We'll talk about renters in a moment, but banks have agreed to give homeowners some relief. Aaron Saltzman looked into how that offer is working in practice.
My wife called the 1-800 number for the Bank of Montreal.
Evan McFattridge's wife was laid off when the Halifax area restaurant she works at closed.
She was told that our mortgage was too new to qualify for deferral.
Not what he expected to hear.
I've been in regular communications with the CEOs of Canada's large banks.
Last week, the finance minister asked the big banks to defer mortgage payments for people suffering financially due to COVID-19. But many Canadians say they're encountering an opaque and seemingly arbitrary process, which often ends with them being denied a deferral.
Just huge anxiety.
Allison Whittle and her husband are both in isolation, both showing symptoms and both out of work. But when she called her bank, a subsidiary of Laurentian Bank, she was told it was business as usual.
That was very triggering. I got quite upset because it's not business as usual. We're not going to be able to pay.
The experience may be different with lenders that aren't one of the big banks. Even before the finance minister's request, this Vancouver credit union was offering 3-month deferrals.
One of the phrases that we use in our organization for times like this is forbearance, not foreclosure.
Now she says they're offering the full 6 months with little more than a quick phone call or email. CBC News asked each of the big banks about their deferral process. CIBC, Scotiabank, and TD each just repeated their commitment to working with people on a case-by-case basis. RBC didn't respond at all. BMO says it has now reached out to the subjects of our story. After the McFattridges got that call from BMO, the bank granted them a 6-month deferral. Allison Whittle just got a call back as well. She, too, got her deferral. Aaron Saltzman, CBC News, Toronto.
While homeowners can get relief on a case-by-case basis, Thomas Douglas shows us that those who rent have even fewer options.
Like so many small business owners, Joe Rutherford has seen his income nosedive, dropping in recent days as much as 85%. He walks dogs and hires others to do the same, but now worries about the roof over his head in Toronto's notoriously pricey rental market.
If there's no money coming down the pipeline, we can't be sure that we can pay our rent. And I mean, it's so scary.
He started an online petition demanding the cancellation of rent and mortgage payments during the COVID-19 crisis. It's received more than 500,000 signatures, with Canadian renters asking for immediate government help.
I think the easiest, simplest thing to do would be to have a package where tenants just don't have to pay rent, and they can use that money to live and to take care of themselves.
The federal government is pledging money for low-income families, but when it comes to relief for renters, it's up to the province to decide, with BC, Ontario, and New Brunswick suspending some evictions for now.
No tenant in the province of Nova Scotia whose income has been impacted as a result of COVID-19 can be evicted by their landlord.
Though some tenants fear unpaid rent will eventually lead to mass expulsions. Consider these renters in Toronto who say neighbors received eviction notices just this week. A mistake, says the landlord, but many property owners are still demanding payment.
So for us, it is important that things keep moving, of course. We cannot afford just to not receive any rents.
Virginie Michaud owns this duplex and depends on the income from the one unit she rents out.
We're counting on that because we don't have a lot of cushion in our budget.
This crisis is squeezing everyone, and it only gets worse at the first of the month. Thomas Douglas, CBC News, Toronto.
Next, we look at what we know about exactly how this virus is spreading, the science of COVID-19 right after the break. And in China, celebrations and signs of victory, but is it all premature? And as we've been doing all week, we put your questions to the experts, including this one. Do I need to wipe down delivered groceries and packages? The answer to that and more after the break. In Asia, there are countries that have managed to flatten the curve, but not yet in Europe or the United States, and right now, not here either. Canada's first case was on January 25th. That number at first climbed slowly, 29 days later hitting 10 cases, but it took only another 17 days for Canada to pass 100 known cases, and just 9 more to pass the 1,000 mark today. Some of that acceleration might be a reflection of increased testing, but the virus is also rapidly spreading. Vicadopia dives into the latest research on how.
Much of the biology of this coronavirus is still a mystery, though scientists believe it does a better job of sticking to our cells than the coronavirus that caused the 2003 SARS outbreak. That gives it an edge in quickly infecting people. Those people can go on to infect others before showing symptoms, which could take up to 2 weeks. A new study of recovered COVID-19 patients in Wuhan gives us a clearer picture of how long those symptoms typically persist. Coughing lasts 19 days, fever breaks after 12 days, but midway through fever, respiratory problems develop and last as long as the cough. Patients still tested positive for the coronavirus for a median of 20 days, but in some cases it was as long as 37 days. Research is still emerging, but critical for scientists.
We are hanging off of every word that comes out.
Dr. Isaac Bogosh says it's possible people can still infect others after they've recovered, but odds are they won't.
As the clinical condition progresses and as people start to recover and get better, they're likely less contagious to those around them. And ultimately, they'll stop shedding virus and they won't be contagious to anybody.
And where that virus is shed may determine how long it remains a threat. A new study found that it can survive on porous surfaces for hours and on hard surfaces like plastic and stainless steel for days. And there's still no consensus on whether recovered patients can get reinfected.
One oddity of coronaviruses is that the antibodies that we make don't seem to persist for as long as antibodies we make to other infections, like influenza, for example.
Influenza is relatively well understood and monitored. If there's one thing that's being learned from this pandemic, is the need to continue studying coronaviruses, even after the outbreak is over. Vicadopia, CBC News, Toronto.
The World Health Organization is trying to find some positive news in this pandemic, and here's what the head of the WHO had to say about the city known as Ground Zero for COVID-19.
Wuhan provides hope for the rest of the world that even the most severe situation can be turned around.
Wuhan reported no new cases yesterday. However, it still has 6,100 others, with more than 2,000 people in critical condition. But as Sasha Petrusik explains, that hasn't stopped China from declaring victory over the virus.
The pictures on state TV are spectacular. Nanjing skyscrapers lit up with portraits of doctors and nurses, heroes of what China calls its people's war against a virus Beijing has now declared defeated. Recovered patients are applauded as they're shown heading home from hospital. Medical workers, too, paraded as they fly out of a Wuhan that's still locked down. Now we are returning home, so I'm really excited as we won the victory over the epidemic, the medical worker says. Life in most of China, including the streets and stores of Beijing, is slowly returning to a kind of normal, though carefully checked by volunteers with thermometers at every corner, still nervous. Indeed, while Chinese officials say they've seen no new domestic cases in days, they say imported cases are at a record high.
So for China, I think it's premature to celebrate. There will be a second wave in China because I think it's unavoidable. There's going to be silent transmission, which eventually reaches to the level that's detected.
A second wave bouncing back from Europe and Asia on the medical staff who haven't had much of a breather, and a population of hundreds of millions who suffered through the lockdown.
To try to stop that, China finds itself imposing ever more stringent limits on who can come in and how long they need to be quarantined. Exactly the kind of measures Beijing denounced when other countries imposed them on Chinese citizens just a few weeks ago. Sasha Petrusik, CBC News, Tokyo.
Since the COVID-19 outbreak began to accelerate in Canada, we know that many of you have questions, a lot of questions about how to keep safe, how to keep your family safe, about what is or what isn't relevant in this situation. So we've been committing time on each show to finding those answers. And joining us again is Dr. Alison McGeer, an infectious disease consultant with Sinai Health System, and another familiar face these days, Dr. Isaac Bogosh, infectious disease specialist at University Health Network. As we've mentioned, lots of questions for you. And Dr. Bogosh, let's begin with you. And let's talk about face masks. Have the guidelines for civilians, ordinary people, using face masks changed?
No, they really haven't. We firmly believe that people in the general public should not really be wearing face masks because it doesn't really provide any additional protection against getting this infection. If someone's infected with the virus, it's very helpful that they wear a face mask to help prevent them from spreading it to other people, but they're not really going to prevent people from getting infected.
Dr. Muir, let's go on to the next question, which is about deliveries. The specific question was about when people get groceries delivered, should they be wiping it down when it comes to their home?
You know, what's more important than wiping it down is cleaning your hands afterwards. So I think, you know, in general, when you've come into contact with something from the outside, another person that you have to come into contact with for some reason, the answer is after that, you should be cleaning your hands. That's more important than wiping it down. Most wiping down doesn't do nearly as much good as getting soap and water or alcohol hand rub on your hands.
A question for both of you, and I'll start with you, Dr. McGeer. In terms of the amount of testing we're doing in this country, is it enough?
You know, we'd all like to be doing more testing, but there's a limit to how much testing we can do because of the supply chain for all the things we need to do testing. You know, we've just asked the people who supply the swabs, the reagents for the testing, the machines, our staff to do many, many more tests in every country around the world simultaneously. And so ramping up production to have as many tests as we like is really, really difficult. So we're trying to make sure that we're doing the tests we need to be doing and not doing the tests we don't need to be doing. And I think people are doing a pretty good job of that. But it does mean that for people who are mildly ill, where they'd like to know the result of the test, and we might also like to know, but it's not going to change what we do. We're saying, bear with us, can't be tested now, you just need to self-isolate at home.
Dr. Bogosh, you know what? I'm going to skip ahead to a different question now because we're running out of time. I think a lot of people have this one. Somebody wrote in to say that they were visiting the United States. They've come back. They have their 14 days of self-isolation. But during that time period, can they go outside for a walk? Can they take their pet for a walk, or are they stuck inside?
No, you're supposed to stay at your home. It's very clear on the Public Health Agency of Canada webpage what exactly self-isolation means. You're supposed to stay in and around your house. It's not meant to be, you're not meant to be walking down the street or walking your dog. You can stay in your house, and I'm sure you can go outside in front of your house, but you're really supposed to stay around the home for that time.
Lots more questions. We're not going to get to them tonight, but Sunday on the next National, we certainly will pick up where we left off. Thanks to both of you.
Anytime.
Nice.
So we will be asking your questions about COVID-19 each night going forward. So you can send us questions. You can message us directly on Instagram at CBC The National, or you can send an email at thenational@cbc.ca. Next, we'll take you inside the warehouse of a big Canadian retailer to find out how they're coping after all that panic shopping that we saw this week. But first, she may be in self-isolation, but that's not stopping Kaylee Dimmock from dancing with dozens of strangers around Halifax. She's hosting daily dance parties on her balcony, and others are joining in online.
It's just a small way to have a little bit of an impact on people and to also bring people together.
She says she's been blown away by the response and plans to keep dancing. Her playlist already lined up for next week. If you've been to a grocery, pharmacy, or big box store lately, chances are you spent some time wandering the aisles only to find empty shelves and picked over products. Fears over COVID-19 have led to panic buying, even hoarding. And that's raised concerns over how long supplies might last. Stores can't restock fast enough, so I spoke to the president of London Drugs. That's one of British Columbia's biggest retailers. They sell everything from toiletries to TVs. We met at the country's main warehouse, keeping our distance, of course, and I asked him what the last couple of weeks have been like.
Well, it's obviously unprecedented volume that we're seeing in some categories going through the essentials customers need, and unprecedented sales collapses in non-essentials discretionary items. You can clearly see that the consumer is focused on the essentials to get them through this crisis.
Let's talk about toilet paper. Did that take you by surprise?
Absolutely. We've never seen anything like this. The toilet paper is not something we understand. It's caused hundreds and multiple % increases in toilet paper. There's a certain degree that you would expect people to purchase certain things because of the frequency. Hand sanitizer, they're cleaning more often. That would be a natural thing you would see. But the toilet paper is simply hoarding, I think, is what's going on.
So, besides toilet paper, I asked Melman what else has surprised him.
I would say that the something like the payment methods weren't something that we anticipated. We're seeing a dramatic increase in Visa, MasterCard, American Express use. We don't know if that is because consumer budgets are tapped out and they're needing to purchase their essentials on other things, or if it's they're worried about touching money. We're just not clear. That would be an example of a surprise. We're a little bit surprised that it took a while for things like pet supplies and diapers to catch up with the madness around toilet paper, but that's definitely something people are thinking about now.
Now, you mentioned this earlier, that products that aren't being considered as essentials or must-buys by the public, you're seeing sales of those drop right off. Tell me more about that.
That's right. It's very clear that the public is spending all their money right now on purchasing essentials, and anything that is discretionary, like a big screen TV or a consumer electronic item, well, I've never seen sales declines like that. And I think when you look in the retail landscape, you're seeing a lot of stores close, in part to support the government's orders of the spread of the disease, but also a real dramatic impact on those discretionary item retailers.
There is a lot of panic out there, and some of this panic, I think, has to do with people worrying that, places like your chain are going to run out. What do you say to those people?
Well, first of all, the government's federal, provincial, municipal, and industry trade associations have never worked more closely together. Federal ministers are calling directly, provincial ministers are working with agencies. We're passing on best practices and ideas to make sure that Canadians can be assured that they will get through this and there will be goods for them to make sure that they're fed well and taking their prescriptions. There's no shortages in the supply chain if we're only consuming what would be reasonable in these circumstances. The supply chain will and is catching up to backfill those sudden urgent demands of hoarding, and we're not seeing anything that's causing us long-term concerns at this point.
And what about staffing concerns? From the warehouse to the stores, how are people holding up?
I know that our employees are tired. They're working relentlessly. They're working through some very difficult customer interactions that aren't as patient in the store. And they're afraid for their own families because we are an essential service and there's public. They're worried about their own health. Could the next customer make them unwell? But everyone's just been amazing at pulling together, understanding these aren't perfect times, and really rallying on the customer's behalf.
We also know, of course, Canada's medical staff are on the front line of dealing with the COVID crisis. But what if you need to see your doctor for another reason?
What are you going to do if somebody's in there who's sick, who does have COVID-19?
What family doctors say they need next. But first, COVID-19 means parishioners can't gather in person, but a pastor in Grimsby, Ontario, has made sure they're together in spirit.
We know that the power of prayer is greater than this pandemic.
Inspired by a priest in Italy, Father Rico Passero of St. Joseph Catholic Church, he's found a way to deliver masses to a full house.
We printed all of the parish photo directory photographs of all of our families, and after printing them out, we placed them in the very pew to which they would worship on a weekly basis.
Mass is also streamed online so people can connect from home, and the response has been incredible.
The emails, the phone calls, the texts, the messages online have been overwhelming for me to see that indeed people are seeing this project as its original intent, a message of hope, not to despair, not to feel isolated or alone, but rather to stay connected
Frontline healthcare workers have been praised during the COVID-19 outbreak by government leaders and many other Canadians. But praise is not enough. Doctors and nurses are warning about a critical shortage of protective gear even before the expected spike in cases. Nick Purdon went to see how one clinic was coping before stricter social distancing protocols came into effect.
So school is closed.
Yeah. 3 weeks.
I know. What are you going to do for 3 weeks at home?
With COVID-19, a visit like this to your family doctor might be a thing of the past.
Now, since we have everybody here, should we also do other stuff for everybody else today since you're here? Any other issues since you came all the way here so you don't have to come again for other stuff?
No, I think we're good. Liam,
Dr. Javid Alou takes care of 15-month-old Ethan.
Yeah.
People's day-to-day health issues don't stop because there's a pandemic. Still, I wonder, how will primary care change because of COVID-19?
The reality is nobody knows how to practice this way. None of us have actually been trained to work during a pandemic. All the regular stuff, we're going to be here for you throughout this as much as we can.
Maria DeMurrell brought her son in because he had to get his shot.
Did you ever think you wouldn't come in today?
Yeah, my husband and I did have a conversation about it, and he was more terrified than me. So his concern was, what are you going to do if somebody's in there who's sick, who does have COVID-19?
That's the risk Dr. Alou has to balance.
We're trying to make the best decision between the risk of not coming in and the risk of coming in. And so we're going to be making compromise decisions here. And there's going to be some people we protect this way, and there's some people who are going to get hurt this way. And so we're facing the reality that we're not doing the best we can anymore. We're doing the safest we can, given two really bad risks. The risk of not managing the illness and the risk of COVID.
To minimize that risk, most of Dr. Alou's appointments will be by video or phone, and others delayed. And that's not just to protect his patients, but also himself.
Because this will last us around...
So far, the government has not provided protective equipment for Dr. Alou's clinic. The only masks he has are left over from the H1N1 epidemic in 2009.
We have no N95 masks.
You're saying you don't have what you need to do your job?
I don't have what I need to do the job safely.
What do you think of that?
It's scary and it's upsetting. So we would expect that we're willing to put ourselves on the line here, be the front lines, knowing the risks, knowing we're going to have to do more than we're used to doing, and to be prepared for that.
Still, no matter what happens in the coming weeks, Dr. Alou will be here.
We chose this profession wanting to be able to be of service to people. And it's hard to give that up. That's the bonding obligation that I have to them. That's the relationship that I had with them when I took on the decision to be their family doctor. And that's why I'm still there.
Thank you. Take care. Take care.
Bye.
Bye.
Nick Purdon, CBC News, Toronto.
Next on The National, a loud thank you to those working the front lines.
Thank you, healthcare workers.
Our moment is up next. Healthcare workers are so busy these days, and with social distancing, it can be hard to know how to thank them. But some people have found a way to cheer them on. The Nurses Association in Ontario suggested a way for people to show their support, and those creative thank yous are our moment.
Thank you, healthcare workers.
All the incredible nurses, physicians, healthcare workers. Thank you, thank you, thank you.
Just want to say thank you so much. We'll be out here every night at 7:30.
This is for all the nurses and doctors that are fighting this for us. Thank you.
Thank you to our healthcare superheroes who risk their lives for us every day. Together we can do it.
Well, if you're on the other side of those thank yous, you are among the nurses and doctors and other healthcare professionals who are spending so many hours and taking risks to an extent, obviously, to help protect us all. Let us know how that thank you is being received. That is The National for March 20th. Good night.